So that's the Affordable Care Act. Better protections for Americans with insurance, a new marketplace for Americans without insurance, new tax credits to help folks afford it, more choice, more competition, real health care security, not just for the uninsured or underinsured, but for all of us, because we pay more in premiums and taxes when Americans without good insurance visit the emergency room. We get taxed. And since we all benefit, there are parts of this law that also require everybody to contribute. They require everybody to take some measure of responsibility. So, to help pay for the law, the wealthiest Americans, families who make more than $250,000 a year, they've got to pay a little bit more. The most expensive employer health insurance plans no longer qualify for unlimited tax breaks. Some folks aren't happy about that, but it's the right thing to do. Just like in Massachusetts, most people who can afford health insurance have to take responsibility to buy health insurance or pay a penalty. And employers with more than 50 employees are required to either provide health insurance to their workers or pay a penalty. Again, because they shouldn't just dump off those costs onto the rest of us. Everybody's got some responsibilities. Now, it is also true that some Americans who have health insurance plans that they bought on their own through the old individual market are getting notices from their insurance companies suggesting that somehow, because of the Affordable Care Act, they may be losing their existing health insurance plans. This has been the latest flurry in the news. Because there's been a lot of confusion and misinformation about this, I want to explain just what's going on. One of the things health reform was designed to do was to help not only the uninsured, but also the underinsured. And there are a number of Americans, fewer than 5% of Americans, who've got cut-rate plans that don't offer real financial protection in the event of a serious illness or an accident. Remember, before the Affordable Care Act, these bad apple insurers had free rein every single year to limit the care that you received or use minor pre-existing conditions to jack up your premiums or bill you into bankruptcy. So a lot of people thought they were buying coverage, and it turned out not to be so good. Before the Affordable Care Act, the worst of these plans routinely dropped thousands of Americans every single year. And on average, premiums for folks who stayed in their plans for more than a year shot up about 15% a year. This wasn't just bad for those folks who had these policies. It was bad for all of us. Because, again, when tragedy strikes and folks can't pay their medical bills, everybody else picks up the tab.